Well, child examinations. This is the template that I typically use to do well child visits. You can ask the patient when you enter the room if they have any questions or concerns. You go over their history if they have any of that, who they live with, who kind of watches them. Is there a parent at home? Are they in a daycare situation? Are there any issues going on at home that you need to be aware of? Of course, asking them what they're, eating, whether it's formula, breast milk, solid foods, any allergies, well water. If they have teeth and they're, over the age of 1, you want to ask if they're brushing their teeth and if they see the dentist, if there's any concerns regarding their dental care, any peeing or pooping problems, any sleeping concerns. Lead risk screenings are typically done when they're 12 months or older. That also goes for anemia risk screening. So you would do like a lead level and a CBC, any TB screening if necessary. And then the developmental surveillance is based on their age, and I'll have some slides coming up that'll go over each of those. And going over nutrition and physical activity with the parents if necessary. And then immunizations, again, I have another slide coming up that goes through all of those that they need. Then you would do your physical examination, reviewing the vital signs, and the growth chart with the parents, and then your assessment and your plan. And then the growth chart, you want to make sure that it's going at a nice curve, that their weight, height, and head circumference are going in the proper direction. If there's any concerns that they are losing weight, especially at like a newborn appointment, of course, all babies, can lose 10% of their body weight after like a week after birth, and then they typically put back that weight on. However, there are some babies that just don't seem like they're gaining weight appropriately. So you certainly want to review that with the parents, kind of review what their diet consists of, so you can address those concerns. And of course, close follow-up, whether that's with a weight check, in 1 or 2 weeks to reassess and go from there. So this is the surveillance that's typically recommended for newborn patients, whether they're eating well, they're turning and calming to your voice, they're following your face, they can suck, swallow, and breathe easily. Those are just yes or no questions. This is for a 2 to 4 week old. If upset, you're able to calm them down, recognize your voice, follow you with their eyes, started to smile a little bit, whether that's in their sleep or otherwise, able to lift their head when they're on their belly. Again, yes or no questions. This is the surveillance for a 2-month-old. They're smiling, looking at you, self-comfort, they can coo, as you can just kind of read below. It's just, again, yes or no questions for all of this stuff, just to see if they're, meeting these kind of basic milestones. This is for 4-month-olds, as you can see, 6-month-olds, 9-month-olds, 12 months, 15 months, 18 months, 24 months, 30 months if you need to do a 30-month office visit, and then a 3-year-old visit, 4-year-old visit, and 5 to 6-year-old visit. This is kind of their kindergarten, visit. Then we hit up the vaccine schedule. So typically all kiddos, when they're born, at birth, they get the hepatitis B vaccine, their first dose, unless the parents have declined that vaccination, which you would give that when they see you for their first office visit, usually within 1 to 2 weeks of their birth, and typically it's even sooner than that, usually within like 3 days of their birth. Really depends, but we try to get them in really quickly to address any concerns, give them that dose of hepatitis B if necessary, but most times it's taken care of at the hospital, which is really helpful. And then just kind of goes along for each visit that they're going to have with you in the office after the first initial visit. You can do, what their shots are going to be and what they're going to consist of. A lot of vaccines these days are combination vaccinations, meaning one shot consists of multiple vaccines. For example, if you look at the 2-month hepatitis B, the Tdap, and the polio vaccine are all just combined in one vaccination. And so at 2 months, in theory, they would get 3 vaccines and 1 oral vaccination, the rotavirus. And then as you can see from there, for 4 months, 6 months, etc., what their combination vaccines are and how many they would receive at each of those subsequent visits that they have. This is kind of a nice thing to discuss with parents so that they know what to expect and what to anticipate. I always inform parents that babies can only receive live vaccines when they're 12 months of age. That's the varicella and the MMR. Live vaccinations can sometimes cause low-grade fevers in kids, so encouraging parents, if they need to give them Tylenol or ibuprofen as necessary for that. Of course, varicella and MMR does come in a combined vaccination as well, which is really nice. And then it just kind of, again, screens down further, as you can see, from 15 months all the way to when they're 16 years old, getting that last meningitis vaccination. For flu vaccines, depending on the flu season when that is, between typically September through April, the flu vaccine can be given anytime after 6 months of age. For the first time that they're receiving the flu vaccine, they need to have 2 doses separated by 4 weeks. Again, educating parents that they will have to return for that second dose of that flu vaccine so that they can complete that series. The Gardasil vaccination is another vaccine that's recommended, not technically required, but it can be given starting at age 9 now for boys and for girls. And then the lipid screening, technically the American Academy of Pediatrics recommends all children between 9 and 11 are screened for cholesterol issues. And so that includes a lab draw, asking the parents and, if that's something that they would like to have done, in just going over the recommendations that, why it's done and the importance of this, so that, they can get that blood draw at that office visit. Then you have some screening tools that are very useful during your well-child examinations. The MCHAT is one of those. It's to screen for autism. Typically, this is done between 16 and 30 months of age. And as you can see kind of on the questions, it's simply something that the parents answer before you enter the room. It's just yes or no questions. And then you kind of grade it at the end. And certainly if there's any concerns on this, make sure you ask the parents kind of in detail, just to double check. And then if there's further concerns, you definitely want to get them to see some sort of specialist so they can get evaluated further to make sure this isn't something that needs further workup. And then there's an ages and stages questionnaire that's completed periodically during well-child visits as well. This is just the tail end of this screening. So it's another tool that's given to the parents where they fill out kind of questions about their children's communication, gross motor, fine motor, problem solving, and personal social skills, and then you grade it for them. And if they are above the line, which you can kind of see on that ASQ3 scores area, anything in the white is considered, well above. Anything that's kind of in that gray zone is kind of like, okay, maybe they need to work on some of those things. And anything that's in the darker area is something that they're going to most likely need to see someone to be, for further evaluation. So those are just some, again, screening tools that we use just to make sure everybody is, meeting their goals. And then, of course, if you need to do any sort of referrals, whether it's to speech therapy because they're not meeting their language stuff, Easter Seals is another resource, is a non-for-profit situation that helps with getting children into programs to assist further with any sort of developmental issues that do come up. And then, of course, if there's any other early intervention programs in your area that you utilize as resources, those are other important things to take into consideration. Sometimes even just close follow-up with these patients, on the surveillance questions. If a kid isn't potty trained at that exact age, I mean, that's not necessarily an issue per se. It's just something that you want to discuss with the parents and kind of go through further, So there's some things that sometimes they can't tie their, a knot in their shoelaces before going to kindergarten. It's not necessarily a reason to send them to early intervention for that. Just some things to educate, again, parents on further. So you really, a lot of times, again, speech therapy, Easter seals, and other early intervention programs are typically utilized for pretty significant abnormalities that you've noted with milestones and other concerns that the parents may have. If there's, of course, any issues with or concerns with concentration, focus, ADHD kind of stuff, utilizing the Conners form is what I like to use. So essentially it's giving the parents and the teachers the forms that they can kind of fill out, just like yes or no questions to, how their behavior has been. And then the parents return all of the forms to you, and you grade those forms and determine if they meet the scoring for needing to be on potentially medication for that. Also, you could consider, again, sending them to maybe seeing a psychiatrist to have them diagnose those conditions if it warrants that. There's lots of options. Again, you can discuss with your collaborative or look at UpToDate for other resources, or discuss other resources in your area. Sometimes even social services has to get involved in some of these cases, depending upon what exactly is going on with everybody. And then making sure that you complete, if you have a physical form that you need to fill out, there's a lot of stuff that's already set up as templates in the computer system. If you use Epic, that already have the vaccine record listed, you just kind of fill them out. It's super easy to take care of. Even the forms for the sports physical are very simple to complete and fill out. It's just a matter of checking all the boxes and whatnot. So these physicals for children are relatively routine and not complicated typically at all. So again, if you have any questions, let me know.